KFWB News Time 4:13.
Yesterday, we told you about new polling from Consumer Reports on how Americans are cutting corners with their medications to save money.
Well, the survey by Consumer Reports magazine also cited doctors for not recommending generic drugs to their patients frequently. Some doctors. One local physician took issue with that finding, and we spoke with UCLA dermatologist Dr. Daniel Behroozan.
My first priority to my patients is to give them the best medicines. And if anybody thinks that doctors don't think about the cost of medicine in general, they're wrong. We think about it on a daily basis.
Mm-hmm.
But the most important thing is to give our patients the best medicines for their conditions. Now, certainly we as doctors are overwhelmed with insurance companies too, and we don't know what kind of plans patients have and what patients don't.
Right.
So the first thing is that when a patient goes to a pharmacy and a medicine either isn't covered or there's an alternative, the first thing that should happen is that the pharmacist should take the initiative to call the doctor and find out why they wrote that prescription and if a alternative is possible.
Mm-hmm.
A lot of times, if we think that the brand name has some benefit, and oftentimes it does because it either works better, you have to take it less frequently, so compliance goes up, and these things are important certainly when we're trying to treat disease. Sometimes if we think it's important enough or it's possible, we can actually write to the insurance companies and get permission or authorization to get the brand name drug at the same cost.
But the Consumer Reports study found in this survey of asking patients, they found that doctors are only slightly more likely to recommend a generic for a brand name medicine than not.
Listen, if I have time to spend with a patient, my time is better spent trying to educate them about their disease and how to help them cure that.
Right.
And we're already cut so short with time and with the way, insurers are treating doctors these days that it's very hard to address all those things. And I can tell you, as for myself and all my colleagues and the newer generation of doctors, we are very cognizant of that because we understand that if we are not paying attention to these things, ultimately it's going to affect us and our patients. So I think it's important for these discussions to be had, but I think to generalize and say that all doctors don't care is just completely wrong.
But she didn't say that in the interview.
No, I understand
To be fair, she didn't say all. She said some. So what would you recommend to patients to ask what questions?
I think, people should educate themselves about their insurance coverage, first of all, knowing and understanding that they may or may not have a generic-only coverage on their insurance, and if so, they should bring that up with their doctor. And certainly, if a patient brings that up with me, I'm not going to waste their time or mine to write for a brand name at that point because I know it's going to get rejected at the pharmacy level.
That's UCLA dermatologist Dr. Daniel Behroozan, who disagreed with the Consumer Reports survey. KFWB News Time, 4:15.